Well, it's interesting that you say it was an exciting new area, because actually all the speakers, with the exception of one, made a point of taking the origin of their talk back to the 80s and the 90s. So in the 1980s, we thought gene therapy its most frequent use would be for monogenic diseases such as thalassemia or sickle cell disease or adenosine deaminase deficiency. And in fact, this group have stuck with those diseases since that time and now have some very nice results of treating children with congenital diseases with gene therapy and getting really, really good results. And gratifyingly, treating them with great safety, because that was always the worry about gene therapy. Chiara Bonini spoke about suicide gene therapy, T cells engineered to express suicide genes for the management of immune reconstitution or graft-versus-host-disease. And that also had its origin back in the early 90s. Her first paper was in 1997, but they've really worked very hard on that approach. And Monica Kasushi, she was the person from the same group who talked about her particular CAR cell. And of course, there's been a CAR cell in every session at EBMT, but this was a CAR cell for CD44V6, which looks like it might be very useful in acute myeloid leukemia and in myeloma. So very exciting.